cough is one of the common reasons children are taking to the doctor. But how do you determine the difference between a normal cough and a chronic cough? Because there are a variety of factors that can contribute to chronic cough. So tell me, Dr. Rama, what's the difference between a normal cough and a chronic cough?
Cough is something that we see almost very often.
Yeah.
And if you think about it, at any given time, 30% of children are coughing, and it's a protective reflex. It helps you clear the secretions and also any particles. But the trouble is, what is normal versus abnormal? In general, children less than 4 years of age have about 5 to 8 respiratory illness per year, and those who are a little bit older have about 2 to 5 per year. So what is normal is, after any respiratory illness like a common cold, you recover from the cough by about 1 to 3 weeks. So if the cough is phlegmy or mucousy or moist and it persists as a moist cough for more than 4 weeks, that's not a normal cough. That's the time that we should be worried about. So when there's a moist cough that lasts for more than 4 weeks, you should be worried about. Or anytime if there is a cough that is associated with breathing problems, such as sucking in at the lower part of the neck, or fast breathing that you can notice, or the sucking in between the ribs, that is something you should be worried about and seek medical attention.
Yeah, because it is like a little pull. You can see it, there's sucking in here, and it's in here as well.
Yeah, absolutely.
Usually that shows that the lungs are struggling, working really hard.
Yeah. And also in children, the number one thing that goes off is their feeding. When they're struggling to breathe, they're not able to regulate between feeding and breathing, so they struggle to feed as well, along with struggling to breathe. So those are the things mainly to look for. How long does it last? Is there an associated work of breathing or feeding problems? Those are the red flags.
It often happens at night when the children are asleep, and it's quite problematic as a parent. You're like, are they okay? Are they breathing?
Yeah, it's good how you mentioned. So quite the cough that happens all of a sudden at night is usually the croupy cough, where many parents
like barking dog.
The barking cough with that noisy breathing, or the stridor where you have that noise when you breathe in.
Yes.
You know, so that is something that can happen. If that happens, and if you find that your child is having trouble breathing, first comfort the child, give some paracetamol, and if they look like they're having stridor or breathing trouble, it's good to go and see a doctor.
Absolutely.
But if it's just a cough, then you can give some soothing medications like paracetamol and watch. But if there's stridor or trouble breathing, then you need to go and see a doctor.
So what are some of the causes then of a common cough?
There are a number of causes for troublesome cough. The number one is always the infections. As I said, most of the times you recover within 1 to 3 weeks, but some infections can be severe, or they start off as a virus and then you go on to attract a bacteria on top of them, and they don't seem to clear. So infections are the number one causes. The other causes are the allergic conditions, which include hay fever or asthma, or even severe gastroesophageal reflux can be associated with chronic cough. Sinus problems in slightly older children is another big reason for chronic cough as well. The other thing is inhaled foreign bodies. If you can associate a cough that started off after a big choking episode where your child was having a persistent cough, went red around the face, was wheezing and had trouble breathing, then it's time to think, oh, is this chronic cough associated with something being stuck in the child's airways? So that's another reason as well. And big adenoids can be a source as well, because the big adenoids can get infected and cause problems with clearing secretions and cause cough. Then there are other chronic lung conditions like cystic fibrosis, where you have thick secretions because of a transport defect in the chloride. That is something we usually evaluate when someone has recurrent chest infections or prolonged cough and they're not gaining weight adequately. The other thing is the ciliary problems, where you have the hair-like things, almost like your coral reef, where they help you clear secretions. If that's not working well, that can cause chronic cough as well. And of course, rare but to be thought of is immune defects as well, can cause trouble with clearing infections and thereby result in a chronic cough or a bad chest infections. Neurological causes, kids who have difficulties with swallowing, they can aspirate food instead of going into the food pipe, can go in the wrong direction in small amounts into the windpipe and cause chest infections as well.
So many things. It can also be like vocal tics and things like that as well.
Absolutely. And the main important thing to look for is, as I said, 30% of the kids at any time are coughing. So if it's not associated with your breathing problems or feeding problems and it goes away within 3 weeks, there's nothing to worry. But if not, then it's time to
go and get that looked into.
Yeah.
So what are some of the treatments then for chronic coughs?
So not every cough needs to be treated. That's an important thing to remember. If it's a short duration cough without any trouble with breathing, noisy breathing, then there's no need to treat. Particularly if the cough is dry, 70% of the dry cough resolve by its own. If it's a mucousy, phlegmy cough that's going on for more than 4 weeks, that's chronic bronchitis, then and absolutely needs to be treated. Otherwise, it can cause permanent lung damage and attract more infections in future. The other type of cough that needs to be treated is the cough that's associated with wheezing, which could be a manifestation of asthma. That needs to be treated as well. And those associated with allergic conditions like hay fever, sinusitis, those need to be treated as well. And of course, needless to say, if there's any foreign body stuck in your airways, it has to come out.
Yeah.
And that's the only definitive treatment for that. And there's no easy way of looking. If it's a dry cough, you're more reassured that it's nothing sinister, especially if they're doing everything else like running around, eating, drinking, sleeping well, then you don't have to worry. But if it's a mucousy cough, see how long it's going on for, and that's when to treat. If they are having trouble with breathing, it could be a bad pneumonia. So it's very important to look for their breathing, the sucking in at the lower part of your neck, the chest, and see if that's a pneumonia that needs to be treated. Usually, a fever that happens with the cough usually lasts for 2 to 5 days, but if you have a fever that goes on for more than 5 to 7 days, that's another red flag as well, that maybe the infection is a bit more complicated than just a cold. Yeah.
So much with children's breathing. It's very complex.
When you can't breathe, nothing else matters, does it?
It doesn't at all. So there you have it. If your GP is ever wanting to refer your child to a paediatrician, ask them to refer you to the amazing team at Townsville Paediatrics. They have a team of specialised paediatricians with a huge range of specialty areas, so your child will be in very good hands.